There was a morning about a year ago when I stood at the top of my staircase and I could not go down. Not because I was afraid, because the pain in my knees when I bent them even slightly had become something I could not push through the way I had been pushing through it for 2 years. I stood there at the top of those stairs, holding the railing, and I thought very clearly, this cannot be my life now. I want to tell you what happened next, because what happened next was not what I expected, and I think it might be useful to someone watching today. I had been dealing with joint pain in both knees for about 3 years at that point. It had started gradually, the way most things do at this age. A stiffness in the mornings that took longer to work through. A reluctance in my knees when I went upstairs or stood from a seated position for too long. I had managed it, ignored it more accurately, told myself it was simply aging and that aging was not something to complain about. But by 71, it had become something I could no longer manage quietly. My doctor examined me carefully and said what I had half expected her to say. The joint had deteriorated significantly. She referred me to an orthopedic surgeon. The surgeon was kind, thorough, and completely clear. He recommended knee replacement. He explained the procedure, the recovery, the outcomes. He was not pressuring me. He was simply telling me what he believed was the most effective solution. I said I wanted to think about it. He gave me 3 months. Said my situation was not an emergency, but that waiting too long would make the surgery more complex. I drove home and I sat in my garden with my tea and I thought, I am not ready to hand my body over to a surgery if there is something, anything I have not yet tried. I am not telling you surgery is wrong. Please hear me clearly on this. For many people, joint replacement is the right decision and an excellent one. I am not a doctor, and this is not medical advice. I am telling you my personal experience and my personal choices. Always speak to your own physician. But I was not ready, and something in me said, try first. 3 weeks after that appointment, I was in a grocery store, standing in the produce section, shifting my weight carefully the way I had learned to do to manage the discomfort. And the man beside me, perhaps a few years older than me, noticed. Not in an intrusive way, he simply said quietly, joint trouble? I said yes. We got talking. He told me he had been an orthopedic surgeon for 31 years before he retired. And then he said something that I had not heard from any of the doctors I had seen. He said the conversation around joint pain in older women almost always goes straight to structural solutions, surgery, replacement, intervention, without enough attention paid to the inflammatory environment the joint is living in. He said that for some people, addressing the inflammation systemically through what they eat, how they move, and what they stop doing, creates enough change that surgery either becomes unnecessary or can be significantly delayed. He was not telling me not to have surgery. He was telling me there was a chapter that sometimes gets skipped. I went home and I did something I should have done 2 years earlier. I paid very close attention. The first thing I changed was what I was eating every morning. I had for years started my day with certain things that I will not name specifically because everyone's body is different and I am not qualified to tell you what is right for yours. But when I looked honestly at my diet through the lens of inflammation, I found several things that research consistently links to inflammatory responses in the body. I removed them one at a time, carefully, over about 6 weeks. I want to be clear that I did this with the knowledge of my doctor, who monitored how I was doing throughout. Within about 5 weeks of the first dietary change, I noticed something in my mornings. The stiffness that had been taking 45 minutes to work through was taking less time. Not dramatically less, but measurably less. I am not saying diet cured my joints. I am saying what I personally experienced. Please speak to your own doctor before changing anything about how you eat. I come here every day and I sit with you because my evenings belong to me now, and I have decided they are better shared. If today is your first time here, subscribe. I will be here tomorrow without fail. The second thing I changed was how I was moving, or rather, how I was not moving. I had stopped most physical activity because movement hurt. This felt logical, but what I came to understand through reading and through conversations with my doctor is that for many joint conditions, complete rest is not helpful. The joint needs gentle, consistent movement to maintain the fluid and circulation that keeps it functional. I started walking very slowly, very short distances, around my garden and back, twice a day. That was the beginning. It felt almost embarrassingly small, but within 2 weeks I was walking further. Within 6 weeks I was walking for 20 minutes at a time without the sharp pain that had been stopping me. I also began doing something in warm water at the local pool. I will not call it swimming because it was not swimming. It was moving gently in water that took the weight off my joints while still allowing me to use them. My doctor was pleased when I told her. She said she wished more of her patients tried this before deciding it would not help. The third thing I changed was something I had not expected to matter: sleep. Specifically, the quality of my sleep and the position I was sleeping in. I had not connected my sleep to my joint pain at all. My doctor pointed out that a significant amount of the body's tissue repair happens during deep sleep, and that consistently poor sleep, which I had been having since Edward passed, was likely interfering with my body's ability to manage inflammation overnight. She made some suggestions about sleep position, and I made some changes to how I set up my bedroom for sleeping. Within a month, I was sleeping more deeply and waking with noticeably less morning stiffness. I went back to the surgeon at the 3-month mark. He examined me again. He said the deterioration had not progressed and that my functional mobility had actually improved. He said he was not going to tell me I would never need surgery, but he said that whatever I was doing, I should keep doing it. That was 9 months ago. I still have joint issues. I am not going to tell you I am pain-free, because I am not, and I will not mislead you. But I am walking down my own staircase every morning. I am in my garden every day. I am sitting here with you, comfortably, without the level of pain that was making me consider handing my body over to an operating room. What I want every woman over 65 to hear today is simply this. If you are dealing with joint pain and you have been told surgery is your next step, please make sure you have had a thorough conversation with your doctor about the inflammatory environment your joints are living in, about what you are eating, about how you are moving or not moving, about your sleep, not as a replacement for medical advice, as a conversation you deserve to have before any major decision. You know your body. You have been living in it for a long time. That knowledge matters. Bring it to your doctor. Ask the questions. Explore the chapter that sometimes gets skipped. I am 72. I am still learning what my body needs and how to give it. That learning does not stop just because the number gets bigger. Thank you for being here with me today. I will be here tomorrow. Come sit with me.